for a doctor's visit, we all want to know, or should want to know, how a diagnosis is determined and how the treatment will be carried out. The in-office experience can oftentimes make or break the entire healing process. Here to explain, please welcome interventional spine specialist Dr. Pavin Grover. Hi there.
Hey, thank you.
All right, especially when it comes to back issues, it seems to be this mystery area, you know, and so and you start off with having to figure out what is the problem. So when someone comes to your office, you look at that patient as a partner.
That's right.
You want to share the information as opposed to being the keeper of all the goods.
Right,
there.
and just telling you what we're going to do.
Yeah.
And that's the most frustrating thing I think patients come through is when they have, because they've been given so many different diagnoses about where their pain is coming from, right? And now we would think we have such sophisticated things like MRIs and CAT scans that they should tell us the exact spot.
Yeah, a lot of us think that's what we do. Have an MRI, CAT scan, here's the problem, fix it.
You know, tell me to fix it, but it's not that simple. And I'll tell you why. We're going to draw a diagram here in a second. First of all, discs sometimes do not really cause the problem. For example, we've seen patients, how do we know this? Because I know patients that have a huge disc blown out on their MRI, but they don't have any pain. Or sometimes they'll come in and they'll have pain on the right side, but their pain is on the left. So it's not a direct correlation. Now, if we were to draw a diagram here, the way the spine is structured, and this is how we go through our process. So you have the spine, which is this backbone of the spine, right? In between, you have this disc. Now, the disc is kind of like a cushion, like a shock absorber on a car, right? We're all familiar with that. So this whole structure is kind of built like this, then it's here on the spine. Now, so we know the nerves exit the spine in a little tunnel that's right by the disc. So one problem that can cause pain is a pinching of the nerve, right? Right. So because it's so close. So if that disc slips out, it can pinch this nerve, right? So a lot of times MRIs will tell us that, but that might or might not be what's causing the pain. You also have things called joints, which are called facet joints, and these are joints that allow the spine to rotate and flex, and like other joints in the body, they're subject to arthritis degeneration. Now, we've all heard of sciatica, right? We all sometimes get confused. Is it coming from the back? The sciatic nerve comes through, this is your sacroiliac joint, and the sciatic nerve comes at the bottom, right? So sometimes this pain will mimic pain in the pinched nerve. But sciatica is due to pinching of the nerve right here. So basically,
I'm just looking at that little bitty space that we have behind our back. There are a lot of things that could go wrong, as you just mentioned. And you know, in years past, they'd say it's in this area, go in and operate, and it might not be correcting the problem.
It might not be the correct, right? And not only that, but like if you have a problem with your sacroiliac joint, you're not even going to see that on an MRI. So you're going to miss it half the time, and then the focus gets on what we're seeing here.
Right. You all take an innovative approach, and starting with the fact that you don't just say it's in the spine somewhere. You find exactly what it is. Sometimes surgery is necessary. Sometimes there are other things that can be done. So take us through some of the procedures people might have done.
So the first step is how do we figure out whether it's this nerve, it's a joint up here, or it's the sciatica, right? Because you can't really even go completely by physical exam, because it gets a little complicated, right? So you have pain down your leg, so what happens? We start to shift our weight, right? And the muscles start to go out of whack, so it becomes complicated.
And
so
things can get worse if you don't get it
worse,
fixed.
right? So the first stop is a process called diagnostic mapping, where I take a section and I do a functional block. So I can actually come out with an exact percentage. We can take out all this guesswork. I can tell you what % of your pain is coming from the nerve, whether it's inflammatory or degenerative, what % is coming from the joint, and what's coming from over here.
And so if you know what, then you have a better idea of how to fix it, what to do.
Then what we do after that, so suppose now we've located that your pain is coming from a pinching of the nerve, outside or inside.
We're looking at video here of the minimally invasive surgery. And of course, when we say minimally invasive, that means less downtime, less risk of infection, and all those types of things. Much better way of doing things today.
This is a case on a lady who had severe stenosis, and she couldn't walk. She couldn't walk up the stairs. She had a special needs child. She had stenosis that was squeezing off her spine. So we went in with that scope, and we basically opened up and took off some ligament and bone. And within a few days, she was able to walk up the stairs and took off all her pain medications.
That's incredible, because in years past, that'd be an aggressive surgery, be down on your back for a month or so, whatever, and might not fix the problem today because you know exactly where to go, fix the problem. And that's a great story of she's walking up the stairs and doing fine now.
So if it's If it's arthritis, then we have a procedure where I can actually go in with like a heat source, that's like a laser, and I can get rid of the pain fibers in the degenerative area.
That's incredible, because a lot of times people with arthritis have been told there's nothing we can do. Here, we give you some shots and go away, and hopefully you'll be, feel fine for a while. But in this case, if you take away that thing that's sending the pain message, it's gone.
So we can take care of it from here, from the joint, from the disc, and all do it without like a surgery or an incision, all outpatient.
Yeah. New science.
Yeah.
All right. We have a couple people have some questions here. We have Beverly. Hi, Beverly.
Hi, Deborah.
What's your question?
My question is for the doctor. Is there more than one minimally invasive procedure for neck and back pain? Because I suffer from chronic back pain.
Yes, Beverly. There's actually a number of different things that we can do for neck and back pain using minimally invasive. The key is finding out first where the problem is, right? And then if it's a mechanical issue, then we need to do something that will actually decompress it. If it's a problem with a nerve damage, like in the chronic nerve pathway, then it's something that we can laser to get rid of that impulse. So it all depends on exactly the source and then how we fix it exactly.
All right. I started out, I want to be a pediatric neurosurgeon. I feel like I just went to medical school, so thank you very much. And survived it, right? Well, for more information on the minimally invasive procedures described by Dr. Grover, you can call 832-371-1728, 832-371-1728, or log on to innovaspine.com. And as we said earlier, when you know what's causing the problem, you know what to do. Thank you.